Hello guys, I'm pretty much sure you're all doing great and you're all enjoying your life. You're also enjoying watching my videos, practicing radiology, practicing ultrasonography. Today I'm going to talk about the cranial tumor, and that is ependymoma. It's a intraaxial tumor and ependymoma. Ependymoma happens to be intraventricular. It may occur in infratentorial region in 65% of the cases. In 25% it may be supratentorial, or in 10% of the cases it may involve the spinal cord. In case of supratentorial, it will be adjacent to the ventricles or in periventricular region. In case of infratentorial, it will be within the ventricular system. Subgroup of the ependymoma would be cerebral hemisphere ependymoma, which will usually involve the lateral ventricle and trigone of the lateral ventricle. Subependymoma is another category which you will be able to see in older age group, and this would also be within the lateral ventricle or in the fourth ventricle, but two characteristics would be there. There would be astrocytoma and there will be ependymoma combined. That's why it will be called as an subependymoma. If you want to treat that ependymoma, you can resect that surgically, but if it has involved the cranial nerves, then it will become difficult to resect that. And the second thing is there is a chance of recurrence. So these two things you should have to keep in mind. One another point worth noting here, that a very close differential, it has a close differential with the medulloblastoma. Medulloblastoma is less frequently calcification you'll be able to see in the medulloblastoma, while in ependymoma there the calcification is frequent. The second thing is, so far its location is concerned, medulloblastoma happens to be involve the floor of the ventricle, while ependymoma involves the involve the floor of the ventricle, while medulloblastoma involves the roof of the ventricle. So far the shape is concerned, medulloblastoma happens to be round in shape, while ependymoma mold itself according to the shape of the ventricle. So these are all the points. I will further narrate on all these things. There are CT images, there are MR images, so you have to look how it will appear on the these radiological imaging and how we will diagnose that. Then again further I will narrate on all that things. I'm sure you will love this video. Let's start watching these images. Here on this CT axial image, you can appreciate an isodense to hyperdense, well demarcated lobulated mass, and it is arising from the lateral ventricle. However, in that particular case you cannot appreciate the calcification. Cystic elements are quite pronounced, and it is also associated with the obstructive hydrocephalus. So this is what the example of the ependymoma is. Another example of the ependymoma, it is a low grade tumor and it is arising from the ependymal cell. You can appreciate that this is a hyperdense lesion. It is well demarcated and it is involving the I would say left anterior horn of the lateral ventricle, as ependymoma is always arising from the lateral ventricles. Here calcification can also be seen, and it is as usually associated with the hydrocephalus. On these CT images you can appreciate that the ependymoma is arising from the lateral ventricle on the left side and causes associated or significant hydrocephalus because of the compression effect. Ependymoma is always involving or arising from the ventricle, usually lateral ventricle or fourth ventricle. Sometime it usually arising from the floor of the fourth ventricle. Here in that case you can see that it has already involved the right sided lateral ventricle. Another example of the ependymoma, here in that particular ependymoma you can see the well defined round mass which is arising within the lateral ventricle, and it causing a significant compression effect resulting into obstructive hydrocephalus. Beside this, in that case, you can appreciate that there is calcification. So calcification will also be there, and because of the obstruction, there is obstructive hydrocephalus is visible on this CT axial image. Here on these both different reconstructions, you can see that there is ependymoma. So ependymoma always involving the ventricular system. It is the ventricular tumor, and here you can appreciate this is ependymoma. Ependymoma is intraventricular tumor. It is low grade tumor and always arising from the ependyma, and it is 65% happens to be infratentorial. Whosoever you have seen on these images, that was infratentorial ependymoma. So for the supratentorial concern, it usually seen extraventricular, I would say, or periventricular region, but these images which we have seen, these were particularly intraventricular, and that was ependymoma. I do hope that ependymoma would be quite easy for you to understand and to recognize on the CT images, and you may be able to write the conclusive report for that. So keep watching my videos and keep sharing with others with some other information of the brain tumors. We'll see each other. Take great care of yourself. Thank you.